You'll have to tell me how you do the portrait and the landscape at the same time.
We're live. Welcome, welcome, everyone. Let's see. Let's go live on Instagram. Welcome to the KiltzHealth live stream with Dr. Nelson. I am your host, Dr. Nelson. I am a recovering family physician and a metabolic health practitioner. Today, we're diving deep into the power of ancestral nutrition, ancestral human nutrition, and I am joined by Sean Needham. Uh, him and his wife, they bring over 25 years of experience from Moses Lake Professional Pharmacy to help us explore how what we eat and how we manage our hormones can transform our lives. Welcome to the show, Sean. How are you
Well,
doing today?
I am doing great. Thank you so much for having me on. It's always an honor to be with you. So
You're in Washington, correct?
that is correct.
All right. So it's just noontime over there. I want to
Well,
go through some housekeeping. Please, everybody, tell us where you're watching from. I am in Central Florida. As I mentioned, Sean is in the upper west corner of the country, of the at least the lower 48, right? In Washington. And I want to go over some events that we have. I should have brought this up before, but here we go. Okay. So we have a few events coming up. So I put them all together in one graphic. Tomorrow, if you're in Florida, even if you're not in Florida, if you want to come, but if you're in Florida, near Melbourne, Florida, at 11:30 a.m., we're gonna be at Estampa Gaucha in the Melbourne Square Mall with Mike Seeley, All Guy Carnivore, Mitch, and Dr. Nelson. Basically, if you go to to KiltzMeetup.com, you can RSVP there, but when you go there, each one is going to be paying their own meal. It's a very nice place. Lunchtime is cheaper than dinner, and they have a nice room that usually we're at. Next, it will be April 6th on the showing of the cholesterol code screening in St. Petersburg. This is being hosted by Susie Boshoff, Dr. Boss, Dr. Ovadia, and Dr. Kiltz and Dr. Vasquez. Dr. Nelson will be there as well. That's Monday 6th. If you go to KiltzMeetup.com, you can follow the link and buy your tickets for that. The following week, we have a meetup in New York. I believe there's still tickets with Christopher Brandlin, Dr. Kiltz, Miss Meat, and Dr. Nelson. Follow the link at KiltzMeetup.com and you can buy your ticket there if you're interested in going to Long Island. And the next day, we are going to have a meetup with Dr. Nelson and Lois Lotito in Queens, New York. We're going to spend the day at the Mets game and then a Korean barbecue. And that ticket includes a steak t-shirt. Okay, the dinner, the game, and the t-shirt is all included in the same price. We have more events to come, but those are the next four. All right. Let's see. So, Sean, why don't you go ahead, introduce yourself, tell us a little bit about your story. You've been with us before, but for those who may be new here, let us know how you eat, when you started doing that, and then you can tell us about your pharmacist, you and your wife, and you believe in ancestral human nutrition, right?
Yeah.
So, uh, go ahead.
So, my wife and I are both pharmacists. We own Moses Lake Professional Pharmacy since 1998. We're a specialty type pharmacy. My wife and I are two pharmacists that don't believe in drugs to treat most long-term disease. And the reason we believe that is because most long-term disease is created by our lifestyle, mostly our diet. And so, our goal, we have a podcast, Health Solutions with Sean and Janet Needham. And our goal is to educate and empower people to take charge of their own health. And largely that starts without drugs. And Janet and I have, we've struggled with our weight, especially me. I've been obese as an adult. About 16 years ago now, I lost about 60 pounds. And I didn't do it by exercising like crazy. I did it by changing my diet. I was eating horribly, all kinds of ultra processed foods, out of a box, and just eating too much and the wrong stuff. And now I like what you say, ancestral diet. Because do Janet and I follow the carnivore diet? No, not necessarily. Do we focus on meat mostly for our protein? Absolutely. But we do eat some carbohydrates. Now, we do that because we're metabolically healthy. So we can afford to eat some carbohydrates, whether it be vegetables or fruit. Many patients, when they're sick, cannot afford to do that. So we will tell them, stay away from fruit, stay away from vegetables, go strict carnivore. We're talking red meat only for 90 days, whether it's to reverse your diabetes, your hypertension, many other metabolic diseases, including, psoriasis or arthritis. Those can all be healed by diet. And a lot of people don't realize that. So that's kind of our story. And our goal is just to keep educating people about taking charge of their own health. There's my wonderful wife there.
Nice looking couple.
Yeah. So I got to say, I always say, obviously, my wife is much prettier than me and better looking, and she's much smarter than me too. So, it's always nice to have her on the show with me because we add so much together. So.
All right. So if you have any questions for Sean, please put them in the chat. We'll be talking a little bit. I'll ask him some questions, but I prefer to have you ask questions. Just put them in the chat. And if I don't put it up at some point because I missed it or whatever, please put it again. To avoid me missing it, please put QQQ. And let's see, we do have several people here, so I know they will have good questions. All right, so you spoke about, you do eat some additional stuff.
Mm-hmm.
But you also mentioned those who are not metabolically healthy. So if you're not metabolically healthy, you might need to do what I did with multiple health problems, become very strict. So give us a definition of what a purist will say is a carnivore diet. And, there are many variations. Ultimately, the truth is I am in the Dr. Nelson diet and you are in the Sean diet, right? And
Right.
everybody, but in general terms, what is a carnivore diet?
So carnivore diet in general terms is basically meat and eggs. And when you say meat and eggs, it could be beef, it could be pork, it could be chicken, and I'm missing a whole bunch in there, but, lamb or elk or venison, whatever that is. But it's mostly, it's meat and eggs. And you know what? I forgot. It's also dairy. Carnivore is also dairy. Now, I will say, like you're talking about when you're being strict, I think when somebody has, lots of metabolic problems, I think they should probably stay away from dairy, at least for a while, and maybe even eggs for a while, because some people are allergic or sensitive to eggs. Um, and no one that I know of, and you can help me, Dr. Nelson, because no one that I've ever seen, but I have heard a doctor that told me he's seen it. No one that I know of is allergic to red meat. So if you go on a strict red meat diet for 90 days, eggs and dairy, some people can't tolerate. So I don't know. What are your thoughts? Have you seen anybody allergic to red meat?
Well, I haven't personally seen anyone, although I do know uh, two people. One of them was developed alpha gal, which is strictly, it's not an allergy to the meat. Is you get bitten by a tick to which the immune system is reacting, is introducing some antigens to you, and then it confuses the red meat with those antigens that the tick put into you. So the immune system gets a little bit fooled then when you eat meat, red meat after that. But the number are really not that significant.
No.
And it is not common, although it can happen. And unfortunately, what is the solution for that? That doesn't mean you couldn't be carnivore. You're just gonna have to avoid the red meats and have a lot of other stuff: chicken, turkey,
Yeah.
Fish, eggs. Around this part, we call it the baby's diet. Dr. Kiltz coined that term. Babies for babies is the letters are BEBBIS: bacon, eggs, butter, beef. The I can stand for intermittent feasting or ice cream, Kiltz ice cream, and the S is for salt. So babies for babies. Listen, a lot of people get pregnant on that and don't have to do fertility treatment. So, and then some people have to recur to use maybe the lion diet, which is coined by Michaela Peterson, and it's basically red meat, salt, and water. If you're one of those very few that don't tolerate uh, the red meat, you're in trouble. However, I do know someone who's a little bit sensitive to beef, but not to lamb.
Interesting.
Which is another ruminant meat. And basically, ruminant meats, I think they're a little bit better, and most people agree probably better than the monogastric meats, the chicken, the turkey, pork, and other variety of things that we eat. But uh, you mentioned a couple of things like psoriasis, and I always point out all the autoimmune disorders seem to get better when you go on a carnivore diet. And we keep seeing these anecdotes over and over and over. However, it's no longer just an anecdote when we are starting to get some studies that are showing that people do get better. But I've had the fortune to talk to many with the anecdote that they either put in remission or totally reverse things like lupus, rheumatoid arthritis, psoriatic arthritis, multiple sclerosis, and many other autoimmune or chronic diseases that were supposed to never get better, and there were chronic, ever worsening conditions, right? Uh, what did they do? They eliminated plants, they ate only meat, and some of them, not everyone, but some of them have been able to go back and add a little bit of small amounts of plants time to time from time to time, and they might be able to tolerate it better. But let's talk a little bit about hormones. Why is it that a carnivore diet, do you think, helps you improve your hormonal balance?
Well, let's talk about when you mention hormones. I just want to clarify, because when you say hormones, that's a very, as you know, that's a very broad subject, a very broad category. Hormones are a very broad category. Insulin's a hormone, okay? But so usually when we say hormones, we mean sex hormones like estradiol, progesterone, testosterone. And the reason the carnivore diet, your hormones get better in the carnivore diet, is many reasons. But I think one of the biggest reasons is because you're eating saturated fat, which is high in cholesterol. All the sex hormones have a cholesterol backbone. Without, cholesterol has been vilified in medicine, and we talk about cholesterol being bad and causing heart attacks, and that's just completely false in my opinion. In fact, I'm writing a book, Lies I Learned in Pharmacy School and How to Escape the Grasp of Big Pharma. And my first chapter in there is cholesterol, and heart attacks. So anyway, you need that cholesterol backbone in order to make hormones. And there's a hormone cascade. It starts with pregnenolone, and then there's a bunch in progesterone, and there's a bunch of hormones down below. Without cholesterol, you cannot make hormones. And it's also interesting how, there's been studies to show when a person goes on a statin to lower their cholesterol, that their testosterone level goes down. Now, is that because they're aging, or is it because the statin causes it? I don't know, but I don't think it's good to lower your cholesterol. And there's been many studies too, and maybe not many, but there's been studies too to show that, one of the reasons as we age, our cholesterol might go up. So is because our hormone levels decline. So when our hormone levels decline, our body says, oh, okay, well, we need to hold on to and produce more cholesterol so we can make more sex hormones. And what do we do in medicine? Oh, well, I know for the first 50 years of your life, Mr. Needham, you've been normal, and your cholesterol's been normal, but now you're 50 years old and your cholesterol's high, so we're going to have to give you, Lipitor. And in reality, it's like, well, your cholesterol's high because you're trying to boost more testosterone. Your testosterone's low. So the answer is probably to, do a good hormone panel and a good physical and history, and find out if testosterone supplementation is important. Now, just because you take testosterone does not mean diet is not important. Jan, I say this all the time to patient after patient. Hormones are a piece of the puzzle. Sleep, diet, and exercise in that order trumps that. But hormones are a good piece of the puzzle for women and for men.
So obviously, nutrition and diet are very important, but all those others that you mentioned are definitely, each one of those can disrupt your benefits from following a proper diet.
Right.
So, and right. I'd like to always point out, I have a fidgeting toy here in my hands, and I already broke it. Anyways, it's anyway. So I'd like to point out that I'm oversimplifying this, but so people understand. You mentioned hormone cascade, right? We get, everything is cholesterol based, and there is a cascade of events that goes from one hormone to the other. And women, to make estrogen, guess what they need? They need testosterone.
Yep.
And men, to make testosterone, guess what they need? They need progesterone. So if you want to, everybody has the same hormones, just in different amounts at different times of their life. So But if you want to assign the estrogen and progesterone to women and the testosterone to men, we need each other anyways, right? Because from testosterone, you produce estrogen, but estrogen to be produced needs progesterone. It's interesting.
And DHEA is directly upstream from testosterone. So DHEA in men and women is converted into testosterone, right below, which, DHEA is actually an adrenal hormone, mostly made up in the adrenals, not necessarily the testes and the ovaries. So it's confusion we have anytime in medicine or in science when we try to classify hormones or anything, whether it be the classification or mammals or birds. Anytime we put creation in a box and we try to classify it, they always fall out of order because we're not perfect. And so that's why when we say sex hormones are made up in the ovaries and testes, well, they're not all, because DHEA is still a sex hormone, but it's made up in the adrenal glands mostly. So
and we call it sex hormones, but they have many functions in our brain and other organs as well.
Oh, yes. So, I mean, I'm glad you said that, because bones, whether you're a man or a woman, the biggest hormone that affects your bone density, and my wonderful wife Jana is writing a chapter on my book on osteoporosis. It is a passion of hers. Is testosterone. Testosterone is a game changer for osteoporosis, and whether you're a man or a woman, you should for osteoporosis you need to be on testosterone. We are really against the biphosphonates, the Fosamax, oh gosh, what are some other names of them? I can't even think of them right now. But like the biphosphonates. Yeah, that too. But the biphosphonates,
Boniva.
Boniva and Fosamax. Those are not. They don't build new bone like testosterone. They're not anabolic to bone.
I can tell you from a clinical side, I definitely have been frustrated throughout my career with those medications because they do not make good bone.
No,
and I'm simplifying it, right? But they don't make good bone. So it's like trying to build up very poor quality bone on top of your depleting amount of good quality bone, right? And then you still have fractures, you still have complications. The osteonecrosis, particularly in the jaw, brings a lot of problems to people. We could probably talk the whole hour about that, but they are not exactly the greatest medications.
No. I mean, if you want strong bones, you'll do resistance type exercise, weight bearing movements. Jumping is great. You might not want to start out that way, but also you need testosterone and hormones. We're taught that estradiol makes your bones strong, but it doesn't. It just decreases bone loss. It decreases osteoclast activity, but it doesn't increase a building of new bone with osteoblasts. Testosterone's a game changer. And like you said with osteonecrosis, you said osteonecrosis of the jaw. It's a documented fact. It's in the package insert that those drugs can cause osteonecrosis. Prolia also can. Forteo not so much because it works on parathyroid, but still, I don't think that's a fix for osteoporosis. But if it's going to cause, what do you think, Dr. Nelson? If it's going to cause osteonecrosis in the jaw, and dentists won't pull your teeth because your jaws shatter, you think it's going to do any different in your hip? No.
Yeah, no. It definitely can happen in other bones.
Right.
Certainly. We have not much of a question, but a comment from Marilda. Hello, Sean. Bought your book when I first saw you and your wife. You were a guest with one of Bella's coaches.
Oh, that's a wonderful comment. Thank you so much for that. Thank you for buying my book. Stay tuned for my next book. And if you go to, we have a Facebook page on it, and it's on our website, mlrx.com. But it's Lies I Learned in Pharmacy School and How to Escape the Grasp of Big Pharma. I'm looking for release in December of this year. So follow that book. And thank you for the wonderful comment. And thank you for buying my book, Sickened: How the Government Ruined Healthcare and How to Fix It.
All right. So we have a couple of questions. Let's go ahead and take some. Terry B is asking, do you find that helpful? We haven't even broached this subject, so good
Okay.
opportunity to do that.
Yeah, great.
Do you find it helpful to take electrolytes or supplements with magnesium and potassium? What do you think, Sean?
Excuse me. So here are my thoughts about that. I think it really depends on what kind of activity you're doing and how you feel. So, and Dr. Nelson mentioned early on, ancestrally speaking, ancestral diet. I'm big, and my wonderful wife Janet is big on talking about what did our ancestors do. So our great ancestors, what did they do? Did they take electrolytes? Did they supplement magnesium and potassium? No, they did not. Even our great ancestors, even our grandparents didn't probably do that. But so first of all, you can't supplement your way out of a poor diet. That's the key. But I'll also say this. Do I take electrolytes? I do. But I take them dependent on what I'm doing. So if I go out and it's 85, 90 degrees and I'm riding my bike for a couple hours, do I take electrolytes? Absolutely, I do. Does it help me? I don't know. But I do know that I feel better afterwards. So that's all that matters to me. There's no science behind it. And there's some science behind electrolytes, but usually when you follow the science, it's done by people that sell electrolytes, whether it be Gatorade or whether it be Element or Noon or whatever. So that being said, I think it's depending on how active you are, what the temperature is, and supplements with magnesium and potassium. I don't supplement with magnesium and potassium, but again, I think there's some benefit from it. So, if you have issues, magnesium is a smooth muscle relaxant. It can help to actually, the theanine especially, to help you sleep. It's a smooth muscle relaxant to help relax muscles and blood pressure. I'm not saying that it's going to treat high blood pressure. I think that's another underlying metabolic health issue. And potassium, I think, is the same. But you can get, realize that, like Dr. Nelson was saying earlier, the ruminant animals, lamb, beef, caribou, bison, elk, they're all ruminant animals. And you know what? They eat all the things that has magnesium, potassium, and electrolytes in it. They eat that and they concentrate it into their meat. It's amazing how it works. So if you eat those animals, then you should probably, in most cases, be getting enough electrolytes and magnesium, potassium. Now, here's part of the issue. Did our great ancestors, did they eat nose to tail? Which means, did they eat the bone? Did they eat the bone marrow? Did they eat the liver? Did they eat the heart? Did they eat all those organs? Which, for instance, certain organs are gonna have higher, liver is high in vitamin A, for instance. I think heart is high in potassium. So, do we do that now? Most people don't. I don't. So I don't know. What are your thoughts on that, Dr. Nelson? Do you have any comments?
I do. And I do, meaning I do have a comment and I do supplement with electrolytes. But even before I did strict keto or carnivore, I did have a lot of nocturnal leg cramps.
Yeah, there you go.
So the other thing is, the animals do eat the stuff that have many minerals, but our soil has been depleted from a lot of the stuff that otherwise would have been in that meat because the animal ate it. It's not in the rivers. I mean, I don't trust to drink water from any place, not even a spring. I never buy spring bottled water because it, am I doing, some people don't like to filter the water, but I do buy filtered water, and then I do use electrolytes. And My dog is around. Anyways, so I do use electrolytes. Some people don't. If you don't have a need to supplement with electrolytes, then you don't need to do it. But sometimes, especially when you start, and you start having that diuresis that you get, that we call the keto flu, which is basically all the fluid changes. Water doesn't move by itself in a pure state from one place of the body to the other. So when your kidney is releasing a lot of water, it's releasing sodium, potassium, and magnesium with it. So at that time, electrolytes may be helpful, but some people are able to, yeah, especially after you've been doing it for a while, not have any electrolytes. And do you always need it? No. But if you do have any symptoms, in particular the fatigue, the keto flu type symptoms, usually for the first days or weeks. But fatigue and cramps are very common, and for that I do use. I put it in about 40 ounces of water, and I put some other stuff there because I put some creatine sometimes, and I put some exogenous ketones as well. But I do put some electrolytes and then take magnesium separately
at night.
at night. Well, I take it twice a day, in the
Oh,
morning
okay.
and in the evening. Take magnesium glycinate. The other day, interestingly enough, so my wife has restless leg syndrome, and for a few days she was doing worse, and to the point where she was a couple of days ago in severe pain, couldn't hold her leg still. And I gave her a massage with magnesium oil. Okay. Gave her also orally a capsule or two of magnesium. And she got within, 30 minutes at least, better. And then she realized she was taking magnesium every day and misplaced her bottle and was not adding the magnesium to the pills that she normally takes. So in her case, it's been helpful.
Absolutely. And I love examples like that, because you got to find out what works for you. That's why I don't really trust, not necessarily trust, but big studies with thousands of people. Who cares if it doesn't work for you? Find out what works for you, and if it's not hurting you and it's helping you, great. I don't care what the science is behind it. If it works, great. And there's definitely a lot of science behind magnesium. So I have just found
something similar with iodine. Some people, I say, measure it. If you're deficient, take it. If you're not deficient, don't take it. But blindly taking it in huge amounts, which I've seen some people do without measuring it, I think that's a mistake. Because are you deficient? That should be the first clue if you're going to measure. Now, we have a question here, and I'm going to give you the short answer here. I don't know if you want to comment about this, Sean, but I'm going to invite you to come to the Kiltz Method Tribe. We have 3 Zoom calls every week at 5:30 on Mondays, Tuesdays, and Thursdays. So in about an hour and a half after I finish here, I'm going to be in the community. If Juliana, if you're not a member of the Kiltz Method Tribe, then all you need to do is sign up. It's free. All you have to do is go to the Kiltz Method Tribe. It's in the description of all the videos. Wherever you're watching from, it's in the description. But if not, you can search Kiltz Method Tribe or go to Dr.Kiltz.com and find your way to the community. You give your email. That's all it costs you. And the Zoom call is free. We can talk a little bit more about this there. Hello, doctor. What about LDLP number? Give me the LDLP number, which you did, but I need to also know the small LDLP, because otherwise I'm not going to give you an opinion. Or give us the full NMR panel, and then we can evaluate it a little bit better, okay? You lost 40 pounds on carnivore. So here, a comment Sean just made, you lost 40 pounds on carnivore. So who cares about the cholesterol, right?
Exactly. That's exactly what I was going to say. I mean, seriously. It's that simple.
So, so come to the Kiltz Method Trap. We can discuss a little bit more in detail that question, okay? All right, let's see this one here.
So can I comment on that now, Dr. Nelson?
Yeah. Go ahead.
Okay. I love, first of all, you summed it up. You lost 40 pounds. Okay. That's the life-changing thing right there. Who cares what any lab says after you've done that? Now, you can work on some details after you've lost the weight. I get it. I don't know if she's at an ideal body weight yet or not, or ideal body composition, I should say. But we see it all the time. You see this all the time. You know, you'll have somebody reach out in your tribe or whatever. They say, you know, I went carnivore. I lost 50 pounds. I went off my diabetic medication. My cholesterol went up to 250 and my LDL went up to 130. And my doctor's upset because he wants to put me on a statin. And, oh, and by the way, I'm off my blood pressure medication. We hear this all the time. So you reversed all these metabolic diseases, but your cholesterol went up. Does that kind of tell you that cholesterol is not the problem? I mean, seriously, that's how I look at it. We already had a discussion about cholesterol and hormones. Mm-hmm. But here's the thing. Those numbers, I don't really care about. I care about metabolic health. So what is her triglyceride number? What is her HDL number? What is the ratio of triglyceride to HDL? And the lower that number is, the better. We like to see definitely less than 2 to 1. 1 to 1 is even better. But also, what's your fasting insulin? That's probably the best way to look at your overall metabolic health. And I see this all the time with athletes, friends of mine that'll email me or whatever, or reach out to me on social media. Sean, I went to the doctor. You know, my cholesterol's high. Wants to put me on a statin. And I'm like, dude, you can ride your bike for 5 hours at an average heart rate of 160, and you've got less than 10% body fat. Do you really think your cholesterol is a problem? I mean, that's just a rational thought. So that's my comment on that.
All right. Larry Ryan is sort of a statement question. Isn't it true that people in the upper 80s or 90s and older have very high LDL? Well, I can tell you that anyone that makes it over to 100 definitely has high LDL cholesterol and definitely have higher total cholesterol, which maybe is counter to the traditional narrative that high cholesterol and LDL, you know, we can discuss. It's still the number one issue that we discuss in keto or carnivore diets, because the story that's been told to us for the past 70, 80 years is that cholesterol is the main cause of disease. Right?
And I think there was just you might be able to, you're probably better at studies than I am. I think there was just a recent study that came out. I think it was from some Scandinavian country, and it associated people with higher cholesterols live longer. Let's just think about what cholesterol does. You know, we vilified it, but our brain is full of cholesterol. 80% of the cholesterol in our body is made up endogenously. That means our bodies were created to make cholesterol. Only 20% of it comes from diet. And breast milk is full of cholesterol. A newborn baby has high cholesterol. The yolk of a chicken egg is concentrated in cholesterol to sustain a baby chicken, and yet we call it bad. It makes no rational sense whatsoever.
All righty. Let's get rid of this one.
Love the questions. Keep them coming, guys.
All right. So this one, you kind of gloss over it, over the ratio, Christine is asking, what's optimal triglycerides?
So I think in order to, it depends on what your HDL is. The most important part is your triglyceride to HDL ratio. So let's say you have a super high HDL. Let's say you have an HDL of 85. Your triglyceride, ultimately should be 85 or less. So you want definitely less than a 2-to-1 ratio. Some people have an HDL of only 35, which is not great. Their triglyceride could be 70 and they'd be okay, or less than 70. So you shoot for a 1-to-1, but it really shows what your liver is doing to metabolize carbohydrates is what it's really showing. And it really, when you, and just process everything. Our liver detoxes. That's what our liver is for. And when you have a low triglyceride, it usually means that you're metabolically healthy. And a high HDL means that you're metabolically healthy, or a higher HDL. HDL is increased when you exercise. So it also means that you're probably more active. So I'm not one on absolute numbers, Christine. I'm one on, ratio of triglyceride to HDL. And again, that's not black and white. That's just part of the picture. But I will tell you, when I look at somebody's labs and they tell me, well, I eat really clean, and you see that their triglyceride is 200 and their HDL is 40, explain to me what eating clean is. And then you talk to them and it's like, well, they're not eating clean. So if there's 3 labs that you could do, triglyceride, HDL, and fasting insulin, and you can tell a lot about somebody's metabolic health by looking at those 3 labs. I hope that helped, Christine. That was a great question. Thank you.
So let's see. The next question is about potassium. So pretty pause. How much potassium do you recommend in electrolytes? Again, if you're taking electrolytes because you're having some symptoms, then it may vary from person to person a little bit. I can tell you, for example, that element, however they call it, has per packet has 1,000 milligrams of sodium.
Yep.
It has 200 milligrams of potassium, and I believe it's 50 milligrams of magnesium. I might be wrong, but what I do often, if I don't have a pre-mixed electrolyte, and we do have electrolytes that were out of stock for a while, and they should be back again in a short time. I'm not going to give you a specific time,
Right.
but
I'm sharing the ingredients with our viewers if you want to let it in on Element. So you're going to even do that. That's perfect.
This is on the right, our electrolytes, and now we're going to have packets as well. But anyways, what I do when I am making my own, because I already take the capsules of magnesium separately, I don't put magnesium in the water, but I take a teaspoon of any of the salts that I have, and each salt may have different amount of sodium, by the way. But I take a teaspoon and a quarter teaspoon of no salt, which is a potassium salt substitute, and there are about let's say 500. That's a round number, milligrams of potassium there. Okay, is that what you need? I don't know what you need, and again, we're talking about doing electrolytes when you need them. If you don't need them, you don't have to do that.
Exactly.
What were you gonna say?
I'm with you. I'm with you 100%, and I agree with everything you said. I do want to go back on triglycerides, and HDL, especially triglycerides. Is that, one thing that can happen too is like you see something that doesn't make sense, like a lab that somebody that's actually healthy and their triglycerides came back high. Realize that triglycerides, cholesterol, LDL, those are repair mechanisms for injury. So if you've had a recent injury, your triglycerides might be high. So don't look at one lab number and think and let it go to your head. Say, you know what, this doesn't make sense. Let's recheck in 8 weeks. There's usually, in most lab situations, there's no fire, there's no emergency. You can recheck in 8 weeks and things will be fine. Another question, Dr. Nelson, I saw.
Yeah, I'm reading a comment by Juliana who had made the comment about cholesterol, and I'm just gonna post. Oh, this very long link, but that's to go to the Kiltz Method tribe, sign up, and then we can address your questions in a Zoom call. Okay, Juliana? At 5:30 tonight, if you're able to do it, 5:30 Eastern time. Okay. Let's see. Any other comments? Otherwise, let me ask you another question. Let's say most of the people here either carnivore curious, keto. Once in a while we might get other people visiting here who might be on the complete other side of a diet spectrum.
Right.
So you can be healthy eating any way. However, if you're not healthy eating whatever style you're using, or if your style is McDonald's and Burger King,
Yeah.
you might want to consider this. But what would you say to those curious about whether they're keto now, they haven't tried carnivore, or they're curious about it? They're newbies or beginners. What would you say to them?
Here's a couple things. So first of all, I think we need to realize that if they're eating the standard American diet, the SAD diet, kind of like you say, any change in a diet, whether they go Mediterranean, vegan, which I am one of the diets, besides the SAD diet, one of the diets I'm not a big fan of is the vegan diet. I think it's very difficult to sustain yourself on plants alone. And if you look at any culture in history, there's been no culture that sustains itself on plants alone. They've had some kind of animal protein, whether it be fish or whether it be sheep or elk or whatever. That being said, I would say that I like carnivore better than keto, and here's why. I think keto kind of got commercialized, like for instance, and I hope this doesn't happen with carnivore. You've got keto cookies, keto brownies, keto cupcake recipes, pork rinds. That's a good example. Pork rinds are keto. So I witnessed somebody that's on keto. She ate a whole bag of pork rinds. Well, it's keto friendly. Well, yeah, but it's pork rinds in a package. I mean, it's a keto cookie. It's healthy. It's still a cookie.
And there is a chance that those pork rinds might have been done on a vegetable seed oil.
Oh, you're right. Probably, right? Yeah, right. So anyway, and think about this, Dr. Nelson. So I'm guilty of that. That's why I don't buy that stuff. I can eat a whole bag of pork rinds, but could I eat a whole bag of fried sausage? No, I couldn't. So that's what I didn't like about the keto thing. Now I will say there's some of that going on with carnivore. I'm a big believer in eating real food. And when I mean that, I mean, if it doesn't rot, don't eat it. So in general, if it's in a package with a bunch of ingredient lists or even a few ingredient lists, it's probably not good for you. I use the example, I should grab one because I do eat them on bike rides. They're called RX bars. And they're made with, wholesome ingredients, dates, almonds, all healthy ingredients, right? Or all, whole food ingredients. But it's still a bar. It's not, it's packaged. It's like I could eat, each one of them is 280 calories. That's why I use them on a bike ride because it's pretty concentrated calories. I could probably, if I was eating the raw ingredients in those, like 3 dates and 2 almonds or whatever it is, I couldn't eat 5 of them, but I could eat 5 bars. So eat real food for one, like our ancestors did, going back to our ancestral eating. And even if it says keto friendly or carnivore friendly, if it's in a package, and I mean in a package where it lists a bunch of ingredients, then it's probably not the best for you. So, stick with packages. Cause I was talking to Dr. Kiltz once. He goes, of course I eat processed foods. I don't process my own meat, which is a good point. So we kind of have to define what a processed food is, because most of us don't go out and kill our own animal and then process it. We buy processed stuff from a rancher, maybe from the grocery store, which is, neither one of them is bad. But, if you buy a pound of ground beef from the grocery store, it might list the calories on it, but it doesn't have a bunch of ingredients in it. So that's what's most important. I think, eat real food. If it doesn't rot, don't eat it. And if you look at what our ancestors did, mostly they got most of their calories from eating a meat source. And there are some cultures that probably had little to no plants. The Inuit population, the Eskimos, up that far north, they did not have access to a lot of plants. Maybe a few weeks out of the year, maybe from some trading, possibly, but mostly they ate seal, salmon, caribou. They ate meat, and they dried that meat so they could have it all year long. They put salt on it to preserve it. They didn't have a lot of plants, and because it's
usually nose to tails.
That is true, right? Yeah.
All right. Someone has a question for you, Marilda. Sean, how often should D3 be checked? Mine is normal. Now, you didn't put when was that normal. If it was 10 years ago, right, as opposed to last year, might be, but how often would you have it checked, Sean?
So, I mean, that's
she's mentioning she takes D3 20,000 units and 400 micrograms of K2 daily.
I love it. D3 and K2. K2 is meant to go with D3 to take the calcium out of the arteries into the blood. That's great. Although realize this too, that one of the ways that you can get K2 is to eat grass-fed beef. Just saying. So I am really conservative when it comes to checking labs and chasing labs. I call it chasing labs. Kind of like that one comment we just had about that person's LDL. You know what? On all of us, whether we're metabolically healthy or not, if you check enough labs, you're going to find something abnormal. Okay. That's just it. Does that mean something needs to be changed? Well, how do you feel? How are you doing? You got to realize the centurions, the people that have lived to be 100 at this day and age, they were not checking labs for the first 50 years of their life, probably, and maybe not the last 50. So realize that, for one. So I think D3 is very important. I think if there's one supplement you can take, it's vitamin D3. Vitamin D3 is a hormone in itself. We talked about hormones and cholesterol backbone. Vitamin D has a cholesterol backbone. It's actually a hormone. So it does a lot more than, we're taught in pharmacy school, it's good for your bones, but it's good for so many other things, your brain, your immune system. So I'm assuming when you say 20,000 units, I'm assuming you're taking that every day. That's a pretty good dose. That's okay. Whatever works for you. I'd have to know what your normal is. Because a normal is 65 to 100. Was your normal 99? Was it 100 plus? Was it 64? At 20,000 units a day, I'm guessing you're either living way up north and you're not out in the sun very much, especially in the winter, or you're not. You might have an absorption issue. Vitamin D3 is fat soluble, and some people don't absorb it well, especially if they're on certain drugs like PPIs, like Prilosec or Prevacid. So that being said, I take about 7,500 units a day, actually 50,000 units once a week, which ends up being about 7,200 units a day. Most patients need between 5,000 and 10,000 units a day of vitamin D. Okay. Vitamin D is made in our skin in response to sunlight. Most of us aren't out in the sun enough, especially in northern latitudes, and the way the sun rays hit us at northern latitudes. But also, what have we been taught when we're out in the sun? We're not naked. We cover up so we don't get sunburned. Now, I think a lot more information is coming out about, how important sun is and stuff. And we need to acclimate ourselves to the sun and not just go out and get fried. That's for sure. But, I will tell you, if you eat the right kind of diet, even my wife, who is Scandinavian, she used to sunburn really bad. Once she changed her diet, she can't go out in January and be out in the sun for 10 hours, but she doesn't get sunburned anymore. It's amazing. So back to vitamin D. Sorry, I have a passion for these subjects and I get distracted. So I have not had my vitamin D rechecked in like 5 years, and I have no plans on getting it rechecked. Now, I will say this. I'm kind of an anomaly. First of all, I have access to a lot of different doctors, and so I can get kind of any lab or whatever I want when I want. So, and I don't really have to go in and have routine appointments. So I'm assuming, and Dr. Nelson can help me with this, I'm assuming that your doctor, that if you go to a doctor, you don't need a doctor to get D3 and K2. But if you are going to a doctor, I'm going to assume they're going to want labs, including your vitamin D, once a year, which does not hurt anything. I'm just not a big believer in chasing labs. Does that help?
I agree with you. And if it was normal, and normal could mean a few things. You went over that. But let's say it was somewhere between 50 and 100. Then if this is what you were taking when that measurement was done, go ahead and keep doing that.
Yep.
Because that's what took you to that level. She did mention in another comment that she lives in Southern California, but does not spend much time outside in the sun. All right. So we're coming to the top of the hour. Just wanted to go over our meetups again. Melbourne tomorrow. All these meetups are in KiltzMeetup.com. Please, if you're close to any of these places, go ahead and visit with us, okay?
And I'm going to give a plug for one of those. We were, Jen and I went to one in Tampa, and what a wonderful experience. We got to meet so many people, and it was just a wonderful experience. So if you're close to one of those events, don't miss it.
So, Sean, where's the best place to find out about you or the pharmacy?
The best thing, which you can find out about my books and the pharmacy and our podcast, is go to mlrx.com, and more than everything you need is there.
All right. So I did have this up in a minute ago. Before you can scroll back. This is not what I have. Okay. Thank you very much for being with us. 5:30 in the community Zoom call. You have a good day. Eat meat.
Thank you so much, Dr. Nelson. Thank